So right now, this is one of the most frequently diagnosed cancer. One of the most frequently diagnosed cancer. Even though men are more commonly affected than women in lung carcinoma, but unfortunately in recent years, it's the women who tend to develop lung carcinoma more. In fact, in women, the most common carcinoma is breast cancer, but unfortunately, women dying of cancer, when we compare women who has had cancer and they died of it, and if we do a post-mortem of that, we find lung carcinoma is the most frequent cause of death in women. Even though women develop breast cancer more than lung cancer, but the frequency of death is more with lung carcinoma in women. And the trend, why this is happening is because see, all these data are from the Western world. We hardly do any research. All the data are from the Western world, and it's because women are taking up more smoking. And that is the reason women have developed lung carcinomas more than, in recent years, lung carcinomas, in fact, more than men. And unfortunately, it is escalating in women. That is the reason. Smoking is one of the big reasons why lung carcinoma is seen more in women. Okay. And predominantly it affects 5th to 6th decade. So lung carcinoma young age affect kore, but mind it, lung carcinoma is frequently a disease which affects the elderly. Okay. So what are the etiologies? It's very simple. The first one is cigarette. The first one is tobacco. Tobaccoর মধ্যে কি আসতে পারে? Cigarette আসতে পারে, cigars আসতে পারে, pipes আসতে পারে. But out of this, cigarette is most important. Cigars এও কিন্তু হয়, but cigars to a certain extent as compared to cigarette is a bit less. So cigarette when we talk about cigarette smoking, there are 3 things that you must keep in mind. See, everyone knows about cigarette smoking, but cigarette smoking এর 3টে জিনিস মাথায় রাখতে হবে. One is amount of daily smoking. এটা আমরা জানি, amount of daily smoking. The more you tend to smoke, the more is the possibility of the person, the more I shouldn't use the word you, the more a person smokes, the more is the tendency of that person to develop lung cancer. Okay. So amount of daily smoking. Number 2, duration of the smoking habit. How long they have been smoking. First, no problem. Amount of daily smoking. Number 2, duration. First is amount. Kotogulo number of cigarettes amra khacchi. Number 2, for how long the person has been smoking. Number 2. And number 3 is tendency to inhale. Why it is important? Tendency to inhale. Why? No, it has got nothing to do with passive smoking. It has got nothing to do with passive smoking. কিছু লোক আছে সিগারেটটা নেবে এরকম করবে. They don't inhale. What is it? Why tendency to inhale is important? Means the deeper you inhale, importance আছে. Of course, there is an importance. The deeper you inhale, the more is the possibility of the smoke getting into the periphery of the lungs. আস্তে inhale করলাম, smokeটা একটা level অবধি গেল, say central part of the lung. But when you are inhaling it deep, fact, একদম এইভাবে, অনেকে এইভাবে সিগারেট স্মোক করে, means okay, এটা হাসির হতে পারে, ব্যাপারটা দেখতে হাসি লাগছে, হাসির মতো হচ্ছে, fine, no problem. But the point is, there is a scientific reason behind it. The person is inhaling the smoke deeper into the lungs. মানে পেরিফেরিতে যাচ্ছে লাংসের সেন্ট্রাল পার্ট আছে, পেরিফেরাল পোর্শন আছে. কেন এর ইম্পর্টেন্স আছে? যখন আমরা লাং কার্সিনোমার ডিটেইলসে যাব আমি বলবো সেই ব্যাপারটা, এক্ষুনি আমি বলবো রাদার. হ্যাঁ, সো when you inhale, there's more possibility of the smoke getting deeper into the lungs. Means the peripheral portion, the terminal bronchioles, the alveoli, they are getting affected. Keep this point in mind. আমি এবার এইটাতে আসবো. Number 2 is secondhand smoking. What is secondhand smoking? Passive smoking. I smoke, you don't smoke, or you smoke, I don't smoke. তোমার সঙ্গে বসে বসে আমি আড্ডা মারছি, okay, and I inhale the smoke. That is secondhand smoking. Other than this, the environmental pollutants, the air pollutants, we are inhaling it. That is also second-hand smoking, right? Because they're all carcinogenic. Somehow or the other, they're all carcinogenic. Okay, they all contribute to formation of lung cancer. Number 2 is industrial hazards. Industrial hazards. What are industrial hazards? High dose uranium, high dose ionizing radiation, high dose ionizing radiation, uranium, asbestos, etc., etc. Okay, they are all implicated in lung cancer formation. এগুলো আমি বিশেষ ডিটেইলসে যাচ্ছি না কারণ এগুলো it's easy for you. Number 3 is air pollution. Air pollution একটা আমি radon গ্যাসটা কেন দিয়েছি? Radon gas is very much involved in indoor air pollution. Radon gas is very much involved in indoor air pollution. So these are the predisposing factors. Out of this, smoking is by far the most important. So these are the acquired causes. Other than this, you get genetic causes. Other than this, you get genetic causes. Patients with certain gene mutations, they develop lung cancer. So at least 10 to 20 different mutations have been identified. So the mutations can be in the oncogenes, it can be in the tumor suppressor genes like RB, P53, etc. Then in oncogenes like c-KIT and all, EGFR, KRAS, P53 which I have just mentioned, P16, INK4A. So just remember the name of the genes which are in genes and the tumor suppressor genes and the proto-oncogenes which are involved in various lung cancers. Okay, just remember. So there is a the molecular genetics also has to play a role because onek young individuals say at the age of 20, 30 who has never had a smoke in his entire life. There are cases in the literature, the young persons who never smoked has died of lung cancer. So when the researchers did an analysis, they found certain genetic abnormalities. Development এইভাবেই হয় actually. This is how developments take place. So various mutations have been identified in lung cancers. Okay, so এই পয়েন্টগুলো হার্ডলি এইগুলো থেকে কোয়েশ্চেন আসবে। কোশ্চেন কেউ হয়তো প্রবাবলি এখান থেকে কোয়েশ্চেন করবে না, এগুলো ফর ইউর নলেজ আই হ্যাভ টোল্ড ইউ। বাট তার পাশে যেটা লেখা আছে না, precursor lesions of lung cancer. This is important. Just know the names. If you ever do pathology in PG, তাহলে এই জিনিসগুলো তোমাদের লাগবে। But as of now, just remember the names. What are the precursor lesions? Squamous dysplasia and carcinoma in situ. Squamous dysplasia and carcinoma in situ. এখান থেকে কোন ক্যান্সার অ্যারাইজ করতে পারে তাহলে? As the name suggests, squamous cell carcinoma. তারপরেরটা কি? এটাকে বলে ডিপ নেক বলে, DIPNECH, diffuse idiopathic pulmonary neuroendocrine cell hyperplasia. এখান থেকে কি অ্যারাইজ করতে পারে? এখান থেকে কি অ্যারাইজ করতে পারে? হ্যাঁ, small cell neuroendocrine cancers rather. Neuroendocrine, as the name suggests, dip neck, diffuse idiopathic pulmonary neuroendocrine cell hyperplasia. Number 3 is AAH, atypical adenomatous hyperplasia থেকে কোন ক্যান্সার অ্যারাইজ করতে পারে? Yes, adenocarcinoma. So এই তিনটে precursor lesions কিন্তু মাথায় রাখতে হবে, ডিটেইলসে যেতে হবে না, shouldn't be a question for you. If the examiner is a really cranky one, young examiner show off করতে চায়, may ask you, but if you can remember, if you can read, it's fine. But what I'm asking is, all I'm telling you is not to stress too much on this very big topic. Okay, so remember the name of this precursor lesions: squamous dysplasia and carcinoma in situ, diffuse idiopathic neuroendocrine cell hyperplasia, and number 3 is AAH, atypical adenomatous hyperplasia. Okay, so this is just an example. This is just an example which I'm showing you. What is this? Eta ki mean korche? What is this picture? What does this picture indicate? What does this picture indicate? Eta ki indicate korche? This is, what kind of epithelium is this? What kind of epithelium is this? Pseudostratified, ciliated, isn't it? Cilia বুঝতে পারছো? Columnar epithelium. সেটা কোথায় থাকে? Respiratory tract এ থাকে, bronchi fonci থাকে, correct? If I'm correct, just correct me if I'm wrong. So এই যে জিনিসটা দেখতে পাচ্ছো, see you have the এখানে একটা ইম্পর্টেন্ট জিনিস তোমাদের ছবিটা আমি দেখিয়ে দিতে চাই নরমালি সেলস গুলো কি রকম থাকবে নরমালি সেলস দেখতে লাগবে নরমালি নিউক্লিয়াই গুলো দে আর প্যারালাল টু ইচ আদার এরকম থাকবে রাইট এইখানে নিউক্লিয়াই গুলো কি রকম একটা এইখানে তো একটা এইখানে একটা এইখানে তো একটা এইখানে এই জিনিসটা এটাকে কি বলে চলো এটাকে কি বলে yes pseudo stratification now this is a particular term I'm looking for yes loss of polarity very good that's the term I was looking for LOP loss of polarity very good এটা কিন্তু দেখ এখানে কিন্তু একটা polarity maintained আছে alignment এখানে কিন্তু সেটা নেই এখানে কি আছে isn't it একটা নিউক্লিয়াই এখানে তো একটা এখানে একটা এখানে একটা এখানে এইরকম ভাবে আছে so that polarity is gone what does this indicate what does it indicate loss of polarity is the first sign of what dysplasia very good loss of polarity is the first sign of dysplasia very good খুব সুন্দর आंसर করেছিস LOP is loss of polarity is the first sign of dysplasia দুম করে ক্যান্সার হয়ে যাবে না হ্যাঁ ক্যান্সার আস্তে আস্তে প্রোগ্রেস করবে এই পিকচারটা কি ইন্ডিকেট করছে এইটা কি ইন্ডিকেট করছে এখান থেকে একটা bronchial epithelium the pseudostratified columnar epithelium has undergone a metaplastic change one kind of adult epithelium has converted into another kind of adult epithelium so what is it metaplasia of what into what pseudostratified to squamous এই যে এখানে hyperchromatic nuclei দেখা যাচ্ছে isn't it the nuclei are hyperchromatic haphazardly arranged which is moving towards the base তাহলে কি বলে সেটাকে বেস বলছি টপে তাহলে কি বলে সেটাকে this is what dysplasia পরে কি আসতে পারে হ্যাঁ yes carcinoma in situ this is carcinoma in situ probably CIN1 or CIN2 এইখানে CIN1 CIN2 এই পিকচারটা কি ইন্ডিকেট করছে this is also carcinoma in situ but this is in full thickness dysplasia একটা এপিডার্মিসে কটা লেয়ার থাকে যে লেয়ার গুলো থাকে পাঁচটা লেয়ার যে থাকে সেই এন্টায়ার এপিডার্মিস is involved so this is full thickness dysplasia carcinoma in situ CIN3 probably এগুলো হচ্ছে CIN3 and what is this here the base দেখ এখানে একটা জিনিস লক্ষ্য কর what is carcinoma in situ there is dysplasia of the epithelium or carcinoma which is confined by the basement membrane isn't it না carcinoma in situ তে কিন্তু invasion হয়নি that's why it's called carcinoma in situ এগুলো হচ্ছে দেখ এখানে কিন্তু if you observe carefully এখানে কিন্তু পুরোপুরি basement membranes এর মধ্যে আছে if this is the basement membrane here if this is the point of demarcation malignant মানে dysplastic বা malignant cells গুলো কিন্তু they are still within the epithelium versus here they have breached the basement membrane and they have invaded the stroma so that is a invasive malignancy so loss of polarity you have seen then dysplasia মানে loss of polarity means dysplasia এর পরে কি দেখেছো carcinoma in situ তারপরে CIN3 and squamous cell carcinoma okay or rather invasion in the adjacent stroma okay so classification so from a practical standpoint we classify malignancies into two parts one is small cell carcinoma and the other is non-small cell carcinoma small cell carcinoma and non-small cell carcinoma small cell carcinoma and non-small cell carcinoma small cell carcinoma constitutes around 20 to 25% of lung cancers and remember that it arises from the central portion of the lung আসছি আমি highly aggressive and the prognosis for such kind of malignancies is very bad prognosis is very bad small cell carcinoma একদিকে হয়ে গেল other than small cell carcinoma is non-small cell carcinoma. The non-small cell carcinoma মধ্যে কি পড়ছে? Squamous cell carcinoma, adenocarcinoma and large cell carcinoma. এর মধ্যে central portion of the lungs এও হয়, arise করে, peripheral portions of the lungs এও arise করে। আমি আসছি। They are important for pathological staging. এই malignancies, they are important for pathological staging, mind it. So if you see this particular picture, this is from again my favorite, should be your favorite also by now if you have seen the book, Vinay Kamal, okay. A PDF nahi, that's the problem. That's why I have to take pictures, then ছবি থেকে তুলে মেইল করতে হয় নিজেকে, করে তারপরে ওখান থেকে ডাউনলোড করে করতে হয়। That's why it's a bit hazy. So if you consider this tumor, this is, let's start with small cell carcinoma of the lung. Small cell carcinoma of the lung. কোথায় গেল small cell? This is the small cell carcinoma of the lung. Small cell carcinoma, what is the location of small cell carcinoma? Look at the picture and tell me, central or peripheral? Central. And it's a peribronchial growth. Small cell carcinoma is a peribronchial growth. Look at this picture, just look at this picture. তুই যদি পিকচারটা মাথায় রাখতে পারো, things will be fine. What is this? Squamous cell carcinoma. Squamous cell carcinoma is again from the central portion of the lung. Squamous cell carcinoma is again from the, এখান থেকে দেখা যাচ্ছে? অমর তো দেখতে পাচ্ছিস? You are lost. দেখতে পাচ্ছিস ওটা? হ্যাঁ? দেখি কেমন দেখতে পাচ্ছিস? কিচ্ছু দেখা যাচ্ছে না, সামনে গিয়ে দেখ। কিচ্ছু দেখা যাচ্ছে না। Small cell carcinoma is again central. Small cell carcinoma is again central. Okay. Number 3 is this. What is this? What is this? Adenocarcinoma. Adenocarcinoma arises from the periphery. Now see the third point. Tendency to inhale. So when you inhale more, the smoke goes into the peripheral portion of the lung. Periphery te giye ki hocche? Adenocarcinoma, which is more common in women. Probably it's because of a greater tendency to inhale. Jani na, ta ami amar theory bolchi. That can be one plausible explanation. Women probably inhale more. The smoke gets into the peripheral portion of the lung, and this gives rise to adenocarcinoma. So if you read this particular point, if you read this points, you have earned more than enough to get more than pass marks. That এইখানে everything is given in details. Isn't it easy for you to understand? এই picture doesn't it explain actually everything? এই একটা slide doesn't it explain everything? Yes or no? It explains everything. তোদের লেভেলে পরীক্ষায় মার্কস করার জন্য more than enough. To get 60-65%, this is more than enough. If you can draw the diagram, write the points, sufficient. Highlight the points, underline করে দে, লিখে। একদম be sure about your answer and highlight. Make sure examiner sees what you have written and you have written it correctly. More than enough, isn't it? এই জন্য আমি এই টাইপের পিকচারগুলো দিই। Okay. So coming to small cell carcinoma versus non-small cell carcinoma. This is a basic difference I have just explained to you. Okay, small cell carcinoma has very bad prognosis. They widely metastasize and they respond well to chemotherapy. Whereas non-small cell carcinoma, they invade the pre-existing structures. They are less often metastatic and can be treated by surgical excision. Why you can't treat small cell carcinoma by surgical excision is because of the metastasis. So chemotherapy, I don't know about radiotherapy, but chemotherapy, these tumors are quite sensitive to chemotherapy. And prognosis, irrespective of any other criteria, small cell carcinoma, the prognosis is very bad. And for non-small cell carcinoma, the prognosis depends on the stage of the cancer when it has been discovered. Okay. আচ্ছা কেন বলতো why small cell carcinomas are detected a bit late? Why? একটা example দে. Look at this picture. Now tell me why small cell carcinomas are detected late as compared to, for example, squamous cell carcinoma or any other carcinoma. Small cell carcinoma has a what kind of growth? Small cell carcinoma কোথায় লিখেছে? Small cell carcinoma what kind of growth? Huh? Aggressive na. Peribronchial. Small cell carcinoma say if this is the bronchus, it has a peribronchial kind of growth. Peribronchial mane it encircles the bronchus, whereas non-small cell carcinoma has an endobronchial growth. Now tell me why small cell carcinomas metastasize more than hey আছে রুমাল খুঁজে ঠিক আছে আচ্ছা Now tell me why small cell carcinomas has a bad prognosis as compared to non-small cell carcinomas. Peribronchial versus endobronchial. Huh? Yes, because an endobronchial growth ki korbe, it will obstruct the lumen, resulting in what? Atelectasis, collapse of the lung, dyspnea. So identification is faster as compared to peribronchial growth, where symptoms arise probably a bit late. That's why by the time they are identified or they are discovered, it has already metastasized. It has already metastasized. So that is one reason why endobronchial large cell carcinomas probably has a better prognosis as compared to, non-small cell carcinomas has a comparatively, lung carcinoma by far is bad. By and large, lung carcinomas are bad. Okay, but still when we compare cases in lung carcinoma, probably this one, non-small cell carcinomas has a comparatively better prognosis than non-small cell carcinomas. Okay. So again, location versus tumor. Where it is located, portion of the lung. Small cell carcinoma and small squamous cell carcinomas have a central location, whereas adenocarcinoma, large cell carcinoma, and bronchoalveolar carcinoma is a variety or is a kind of adenocarcinoma only. Okay, because it has a lipidic pattern of growth, butterfly sitting on a fence. যেটাকে equate করেছে হ্যাঁ. So this adenocarcinoma, bronchoalveolar carcinoma, and large cell carcinoma, they arise from the peripheral portion of the lung. They arise from the peripheral portion of the lung. Okay. Now cell of origin. এই পয়েন্টগুলো যদি আমার এই পিপিটিটা আমি মোটামুটি যা দিয়েছি না, তুই যদি পড়ে নিস আমার মনে হয় পড়া হয়ে যাবে. আমি 100টা পিপিটি আমি বানাবো না, I'll make maybe 15-20 slides, কিন্তু ওর মধ্যে জাস্ট ইম্পর্টেন্ট পয়েন্টস গুলো হাইলাইট করে দেবো. ওকে, কি পড়ছিস? দেখছিস আমি ঠিক বলছি কিনা? হ্যাঁ 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 Not necessary. ये तो schematic picture है, ये schematic है, ये original picture है. ठीक है. So small cell carcinomas arise from where? Neuroendocrine argentaphane cells, or also known as Kulishki cells. Kulishki cells. T silent. আমি এই ব্যাপারগুলো একটুখানি specific. Kulishki cells. Okay, not Kulchiski, it's Kulishki. Neuroendocrine argentaphane cells or Kulishki cells, they give rise to small cell carcinomas. Yes. Basal cells in major bronchi. Basal cells in major bronchi give rise to squamous cell carcinoma. Last time benche ki korche na? Hey, কি করছিস? ঘুম পাচ্ছে? হ্যাঁ, তোকে বলছি। হ্যাঁ, ঘুমাইনি, শুয়েছিলি? এখানে দেখা যাচ্ছে না রে, কি দেখতে পাচ্ছিস এখান থেকে? you can't hardly see anything from here. So basal cells in major, এগুলো আবার দিও না, basal cells in major bronchi give rise to squamous cell carcinoma. Adenocarcinoma কোত্থেকে arise করবে? Adenocarcinoma means gland. So obviously they'll arise from mucous glands. Because they contain mucin, they will obviously be arising from the mucous glands in terminal bronchiole. And the last one, bronchoalveolar carcinoma, which is nothing but a specific variety of adenocarcinoma, will arise from the Clara cells in the terminal bronchoalveolar region. That's why they are also called as bronchoalveolar carcinoma. So cell of origin kintu important. মাথায় রাখতে হবে। Cell of origin must be kept in mind. কোন সেল কোথা থেকে অ্যারাইজ করছে, কোন টিউমার কোন পার্টিকুলার সেলস থেকে অ্যারাইজ করছে। ওকে, সো দিস আর দ্য ভেরিয়াস ক্লিনিক্যাল ম্যানিফেস্টেশনস। আমি আর ডিটেইলসে যাচ্ছি না, পরে ইউ ক্যান সি ইট। সো ফার্স্ট ইজ স্কোয়ামাস সেল কার্সিনোমা। Squamous cell carcinoma. Squamous cell carcinomas, again, they have a comparatively better prognosis. Why? Because there is an endobronchial pattern of growth. And because there is an endobronchial pattern of growth, the patient spits out the malignant cells in the sputum. So if we do a sputum cytology of such patients, we can identify squamous cell carcinoma very early, isn't it? Kumpache. Prothom point gulo, squamous metaplasia, dysplasia, carcinoma in situ, you know it, I've already explained. So atypical cells can be identified in body secretions. So body secretions ki sputum e paoya jete pare. Okay. And eventually, as the tumor grows big, it will cause obstruction of the bronchus, giving rise to various symptoms, because it's an endobronchial pattern of growth. So what are the various patterns of growth? One is an intraluminal growth. So intraluminal growth means within the bronchial lumen. They eventually penetrate the bronchial wall. And they invade the pre-existing structures. আমি কিন্তু একদম প্রথমেই কম্প্যারিজনে বলেছি এই পয়েন্টটা। The large cell, the non-small cell carcinomas, they have a tendency to invade the pre-existing structures. Okay. Examiner can ask you, which vegetable can you equate a squamous cell carcinoma with? Cauliflower. So when they grow in broad fronts, it gives the shape of a cauliflower. It assumes the shape of a cauliflower. So if an examiner asks you, squamous cell carcinoma can be equated with which vegetable that we commonly eat? The answer is cauliflower. Okay, so it's when they expand in broad fronts, it assumes the shape of a cauliflower. So grossly, the egulo hoche more or less similar. There's nothing new, because you already know squamous cell carcinoma. Most of them are gray white to firm. Cut surface is gray white to firm. Bulky lesions with areas of necrosis and hemorrhage, and histologically can be divided into again 3 grades: well differentiated, moderately differentiated, and poorly differentiated. So this keratin pearls, intracellular bridges, and keratinization, they go in favor of well differentiated squamous cell carcinoma. Okay. So this is about squamous cell carcinoma, and they produce various clinical symptoms like cough, hemoptysis, okay, hoarseness of voice if the recurrent laryngeal nerve is involved. Then paraneoplastic syndrome. I'm not getting into the details of paraneoplastic syndrome now. It has already been explained in neoplasia. Then other lung manifestations. Okay, so these are all the clinical manifestations. Remember the name of the oncogenes which are involved: HER2 new, FGFR1, and which tumor suppressor genes are involved? P53 and RB, retinoblastoma gene, and P53, the guardian of the genome. এই দুটো জিন, এই জিনিসগুলো কিন্তু মাথায় রাখতে হবে। Where do they metastasize? Hilar tracheobronchial lymph nodes, that is within the lungs. extrathoracic lymph nodes এর মধ্যে কি হচ্ছে cervical and mediastinal lymph nodes এছাড়া it can go to liver, lungs, bones, kidney, brain. More or less this is similar. There's nothing much to explain here. You have to remember it by heart. Okay, so this is about squamous cell carcinoma. What is this particular thing? This concentric eosinophilic round structure, huh? Yes, keratin pearls. That is keratin pearls. So keratin pearl jodi amra dekhi, it has, I mean, it's a well differentiated. Again, অনেক criteria আছে classify করা. I'm not getting into the details of those, but that is basically a keratin pearls, concentric round eosinophilic structures. Okay, an onion skin appearance এর মতো. See, what is this? These are all, what can you tell me what this particular cell is? এটা কিন্তু sputum cytology তে আমরা পাই. Sputum cytology তে এই particular cellটা এটা pap stain করা হয়েছে এবং এই রকম দেখতে, এটা কি বলতো? This is a malignant squamous cells. এটা কিসের মতো দেখতে? That is known as a সাপ. কাছাকাছি গেছিস, সাপের মতো, but not sharp. হ্যাঁ, serpentine. আচ্ছা, ট্রাই করছিস. I'll tell you, there's a particular name for it. That's called a tadpole cell. Tadpole দেখেছিস ব্যাঙাচি? That's called a tadpole cell. So when you see a tadpole cell gross দেখা যাবে না, histopathology তে দেখা যাবে না. We can always see it in cytology, especially all these fluids and all. Tadpole cells খুব commonly দেখা যায়. That goes and এত pinkish কেন জিনিসটা, কি বলতো এটা? It indicates keratinization. It indicates keratinization. এই যে এই পিকচারটা কি রকম, এটা হচ্ছে pinkish নিচ্ছে না? So when these cells are pinkish, which automatically means keratinized cell, and keratinized cell goes in favor of a squamous cell carcinoma. Tadpole cell. Okay, so now let's see, adenocarcinoma versus squamous cell carcinoma. This is based on the location. Which one is adenocarcinoma, which one is squamous cell carcinoma? Which one is squamous cell now? Right hand side is squamous cell. This one is, why? Yes, this is in the periphery of the lung. This is more central. The periphery is comparatively free, isn't it? তাহলে কিছু শিখেছিস? Be happy. Okay. Now coming to adenocarcinoma, again adenocarcinoma নতুন করে আমার কিছু বলার নেই. You know how the glands in adenocarcinoma looks like. Glandular differentiation. You have already seen carcinoma of stomach, you have already seen carcinoma of colon. So basically gland formation is similar. So there is nothing new to explain. Glandular differentiation with mucin production. So what are the various patterns of growth? Acinar, papillary, bronchoalveolar, solid, etc. Solid যখন হয় না, এটা খুব poorly differentiated হয়ে যায়. It is most commonly seen in women and in non-smokers. আমি অনেক সময় বলেছি অনেকে স্মোক করে না, সেকেন্ড হ্যান্ড স্মোকিং এর জন্য, যখন সিগারেট সেকেন্ড হ্যান্ড স্মোকিং এর জন্য যে ইনহেল করে না, somehow adenocarcinoma is more common in non-smokers. Okay, again it can be divided into peripheral location. I have explained, I have shown you the picture. Grade is again well, moderate and poor. You know which one is well, which one is moderate and which one is poor. At least you'll be able to explain. You should be able to explain after you're being taught about gastric carcinoma and colonic carcinoma, যেখানে adenocarcinoma predominant. You shouldn't be having a problem to explain how well looks like, how moderate looks like, and how poor looks like. Okay, and again early metastasis to the tracheobronchial lymph nodes, extrathoracic lymph nodes, liver, lung, bone, adrenal, kidney, brain, all those are similar. Okay, so when it comes to immunohistochemistry, the positive for cytokeratin, কেউ জিজ্ঞেস করবে না তোমায়, positive for cytokeratin, EMA means epithelial membranes antigen, and TTF, thyroid transcription factor. Molecular genetics, if there is a KRAS mutation, it has a very bad prognosis. Otherwise, the genes that are involved are P53 and RD1. At least remember these two. Then P16, EGFR, etc. Then we have bronchoalveolar carcinoma. Bronchoalveolar carcinoma occurs in the pulmonary parenchyma in terminal bronchoalveolar region. It is basically a specific type of adenocarcinoma. Okay, it can present as a singular diffuse multiple nodules with lipidic pattern of growth. Lipidic pattern, I don't know, এটাকে বলে butterfly sitting on a fence. রবিন্স যদি বলো পড়ো না, এখানে দেওয়া আছে butterfly sitting on a fence. Okay, so this is basically adenocarcinoma. এগুলো adenocarcinoma glandular differentiation চিনতে তোমাদের অসুবিধা হবে না, glandular differentiation চিনতে অসুবিধা হবে না, শুধু যে জিনিসটা আমি দেখাতে পারি, again look at these cells, these are all the malignant cells which are shed in sputum. Okay, and this particular growth pattern, this is bronchoalveolar carcinoma. Bronchoalveolar carcinoma exam e debe na, relax, just remember it's a lipidic pattern of growth which grows around the pre-existing bronchioles, terminal bronchioles. Okay, now coming to small cell carcinoma. Small cell carcinoma, like squamous cell carcinoma, is associated with paraneoplastic syndrome arising from the central portion of the lung. Prognosis, treated by chemotherapy, prognosis is very bad. এই পয়েন্টগুলো বলতে নিশ্চয়ই কোনো প্রবলেম হবে না। Modes of spread, again direct হতে পারে along a bronchi in a circumferential manner. It's not endobronchial, it's peribronchial. Okay, lymphatic spread আছে, hematogenous spread আছে, most aggressive of the lot আমি আগেই বলে রেখেছি পুরো টিউমারটা দেখতে কি রকম লাগে, so you shouldn't be having a problem in explaining. The morphology is striking here. The morphology is striking. তো 12টা থেকে ক্লাস আছে না, একটা কিডনি শুরু হচ্ছে আজকে, acute and chronic renal failure ইন্ডাকশন নেবে, ঠিক আছে, acute and chronic renal failure, এই সরি morphology is striking. So the tumors are round, oval or spindle shaped and small in size, round, oval or spindle shaped and small in size with scanty cytoplasm and finely granular chromatin equated with salt and pepper. So salt and pepper pattern of appearance. Cytoplasm is scanty with ill-defined boundaries and high mitotic count. Ill-defined boundaries with high mitotic count. And there's something called as Azzopardi effect. You know what is an Azzopardi effect? Let me see who can answer this. Huh? Nucleus ta bhenge gelo, yes. Tumor necrosis er jonno the nucleus gets jeopardized. Tarpore ki hote pare? The DNA comes out and basically DNA beriye eshe it colors the vessel bluish. That is called Azzopardi effect. Encrustation of the DNA by the tumor necrotic cells and the way they affect the color, basically the blood vessels, that is called as Azzopardi effect. Okay, it is characteristic of small cell carcinoma. So this is the whole thing about small cell carcinoma, and these are the various paraneoplastic syndrome associated with small cell carcinoma. এই তিনটে এই পিকচার গুলো যদি দেখো, more than enough. Okay, so this is how the small cell carcinomas look like. Don't worry, small cell carcinomas will not be kept in slide. Even I'll never keep small cell carcinoma as a spotter for you, don't worry. Okay, but just see the pictures, okay. And finally the large cell carcinoma, আমরা নন স্মল, আমরা লার্জ সেল স্মল ভার্সেস লার্জ বলি না, স্মল ভার্সেস নন স্মল সেল, স্মলের মধ্যে লার্জ সেল বেসিক্যালি হচ্ছে হাইলি অ্যাগ্রেসিভ উইথ আর্লি মেটাস্টাসিস, মানে এখানে বেসিক্যালি না স্কোয়ামাসের ডিফারেন্সিয়েশন পাওয়া ডিফিকাল্ট, অ্যাডিনো ডিফারেন্সিয়েশন পাওয়া ডিফিকাল্ট, ইটস লার্জ সেল. ওকে, undifferentiated, just remember the name of the structure, just remember the name of the malignancy is large cell, means undifferentiated. এখানে squamous cell বা glandular differentiation অনেক সময় আমরা আইডেন্টিফাই করতে পারি না. Cells are so pleomorphic, cells are so large, hyperchromatic with large nuclei that the parent structure is totally gone. The resemblance to the parent structure is totally lacking, and that's why we call it a large cell carcinoma. Highly aggressive tumor, early metastasis, very bad prognosis. Okay, now important thing is diagnostic modalities. এটা কিন্তু কোয়েশ্চেনে আসতেই পারে. Diagnostic modalities এর মধ্যে কি কি আছে? Chest x-rays, chest x-rays, right? Chest x-rays can identify lung cancer in most cases. Point number 1 is, so you start with radiology. You start with radio imaging techniques. That means that comes under radiology. Chest x-ray. Chest x-ray পরে আমরা কি করব? Mediastinoscopy. Mediastinoscopy তে আমরা কি দেখব? Mediastinoscopy মানে mediastinum-এ spread করেছে কিনা আমরা দেখব. We are going to see if the tumor has spread to the mediastinum or not. Right? Involvement of the mediastinum can be identified. The ACs are actually very bad. মানে কাজ করে না. Number 3 is CT scan. CT scan, which enables the surgeon to know if the tumor is surgically resectable or not, which enables the surgeon to know if the tumor is resectable or not. AC temperature এটা কি মানে সবচেয়ে কমানো? কীর্তি, AC temperature কি কমানো পুরো নাকি এটা একটা ফিক্স করা? ও 16ই দেওয়া আছে, তো সবচেয়ে কম। ঠিক আছে, ঘরটা বড় তো বুঝলাম, তো 1 2 3 6টা এসিতে হবে না, তাহলে বোধহয় টানটা কম হয় এসিটা। ঠিক আছে, কম টানে। 26 এ দেওয়া আছে, ঠিক আছে, ওটা কম করতে হবে। Anyway, so CT scan enables the surgeon to identify if the tumor is resectable or not, and if the draining lymph nodes is more than 2 cm in size. If the draining lymph nodes is more than 2 cm in size, then most likely the metastasis has occurred versus draining lymph nodes which is less than 2 cm in size, where metastasis is unlikely. Number 4, MRI. MRI e ki korchi? Again, to evaluate metastasis to various organs. Okay. Number 5, PET, positron emission tomography. Positron emission tomography with the help of FDG, fluoroxydiglucose. Okay, fluoroxydiglucose দিয়ে আমরা দেখি whether the tumor again has metastasized. Is basically a radiolabeled dye. Basically the radiolabeled dye where the cancer cells avidly take up the dye. The normal cells die, they take up the dye, but the cancer cells are even stained darkly. So that is called FDG PET. Number 5, fiber optic bronchoscope. After bronchoscope is put down in a lung, and basically first of all the malignancy is identified, and then we use it to take representative samples for biopsy. So fiber optic bronchoscopy to take representative biopsy samples. Number 6, sputum examination. Number 6 is sputum examination. Again bolechi, cytological examination of the sputum, body fluids, which identifies squamous cell, tadpole cell dekhichi, malignancies dekhichi, etc. মানে adenocarcinoma dekhichi. Okay. Number 7, bronchoalveolar lavage. Just remember the name. And finally, biopsy. Finally is biopsy. Okay. So now you know the various modalities, the imaging techniques, then go for the cytological examination, and finally the biopsy. Okay, that's how you divide it. You get good number. Okay. So points to remember while reporting: diagnostic features including tumor emergence, histopathological type, grade, staging, and blood vessel involvement. এগুলো আমাদের এগুলো maybe a bit high for you, এগুলো PG level এ লাগে. Okay, just আমি করে রেখেছি। Immunohistochemistry তে these are the various markers: NAC, neuron specific enolase, cytokeratin, তারপর হচ্ছে CEA, TTF, CD15, etc. etc. Just remember the names, কোন marker কোথায় লাগে. So various, again, this book is from, this picture is from this book, Vinay Kamal. Not necessary, not necessary. Okay, দুই একটা পয়েন্ট মনে রাখতে পারো if you can, if you want to. এটা আগেও পড়িয়েছিলাম এইভাবে, so I have kept it, but the important points has been explained. So this finishes your topic on bronchogenic carcinoma.